When someone gets diagnosed with high blood pressure, the advice tends to be almost automatic: cut back on the salt. And honestly, that sounds reasonable. It's simple, it feels actionable, and it gives people something to do. But here's the real problem. For a huge number of people, that advice is incomplete at best, and at worst, it sends them in a completely wrong direction. And it's not because salt is irrelevant, because it isn't, but because salt is only one small piece of a much larger puzzle. So when you focus on salt or sodium alone, you end up ignoring the real drivers of why blood pressure went up in the first place. So in this video, I want to walk you through the real causes of high blood pressure that almost always get overlooked. And these are things that you can actually act on today. In many cases, once you fix these, your blood pressure comes down quickly, and sometimes without any medications at all. So what we're going to cover is nutrient deficiencies, metabolic factors, and hormonal drivers that quietly push your blood pressure up. Because once you understand these ignored driving forces, you'll see exactly why the usual one-size-fits-all advice never gets to the root cause. It's why so many people end up with a chronic condition and get stuck on medications for the rest of their lives. So first, let's go over why focusing on salt or sodium is often not enough and sometimes completely misleading. The way this works is that sodium raises blood pressure by pulling water into the bloodstream. That increases your blood volume, which in turn raises the pressure inside your arteries. That part is true, but what rarely gets explained is what happens next. In a healthy body, if your kidneys are working well, they sense that rise in blood pressure almost immediately, and in response, they excrete the excess sodium and the excess water through your urine. As that extra volume comes down, your blood pressure comes right back down with it. This mechanism works remarkably well in healthy individuals. This is exactly why many people can eat salty foods, foods loaded with sodium, and never develop high blood pressure. And it's why there's such a wide variability in salt sensitivity from one person to the next. Some people are extremely salt sensitive and others barely respond at all. So when your blood pressure stays high even after you've cut back on the sodium, that tells you something important. The issue isn't the sodium you're eating, the issue is how your body is processing it. And this is where the real causes of high blood pressure start to show up. One of the first things Dr. Thomas looks at is magnesium. Magnesium plays an absolutely critical role in blood pressure regulation. It boosts nitric oxide and prostacyclin, and both of those help relax and widen your blood vessels. So when magnesium is low, your blood vessels stay more constricted than they should, and that makes it harder for blood to move through them. That's what pushes your blood pressure up. And the reason Dr. Thomas emphasizes magnesium is because low magnesium is incredibly common. Some estimates say almost half of the U.S. population doesn't get enough magnesium through their diet. And we see this in the data too. There's a meta-analysis of 22 studies that found people with lower magnesium levels had higher odds of high blood pressure. And the lower the magnesium, the higher the risk. So why are so many people suddenly deficient in magnesium? A big part of it is the food we eat. We're talking about refined grains, sugary foods, and processed foods. These foods lack many essential minerals, including magnesium. And eating a lot of sugar actually makes your body lose magnesium through your urine, which makes the whole problem even worse. And even if you're getting enough magnesium on paper, you may still not be getting enough. That's because modern farming often pulls minerals out of the soil faster than they get replaced. The food looks the same, but it carries less magnesium than it did just a few decades ago. So how would Dr. Thomas approach this? He'd still prioritize magnesium-rich foods, things like leafy greens, legumes, nuts, and dairy. But just understand that even a great diet today gives you less magnesium than the same foods gave people in the past. For that reason, many people would genuinely benefit from a magnesium supplement. And this is something to discuss with your doctor if you have high blood pressure. There's a recent meta-analysis of 38 randomized controlled trials that found magnesium supplementation with a median dose of 365 milligrams per day for 12 weeks produced small but meaningful reductions in both systolic and diastolic blood pressure. And the effect was even greater in people with high blood pressure who were already on medications. In that group, magnesium supplementation led to nearly an 8 millimeter of mercury drop in systolic blood pressure. Now let's talk about insulin, because insulin is one of the most underappreciated blood pressure hormones there is. When insulin levels are elevated, your kidneys start to retain sodium. They just stop letting go of it. As a result, your kidneys hold on to sodium, they hold on to water, and that pushes your blood pressure up. And this happens even if your sodium intake hasn't changed at all. This is exactly why people with insulin resistance, prediabetes, or type 2 diabetes so often end up with high blood pressure. And it's why blood pressure frequently improves once insulin levels drop, even before someone has lost much weight. So this is another reason why cutting out processed foods, refined carbohydrates, and sugars helps your blood pressure even more than a low-salt diet ever could. Salt can temporarily raise your blood pressure, but it's the persistently high insulin levels that turn this into a chronic problem. And this is also where fructose enters the picture. Fructose is just a simple sugar that gets used as a sweetener or a preservative in tons of processed foods. Dr. Thomas often talks about the problems with too much fructose, especially when it comes to fatty liver. When you consume a lot of fructose from processed foods or drinks, your body makes a lot more uric acid. And that's one of the things that drives high blood pressure, because high uric acid gets in the way of nitric oxide, the very thing that's supposed to keep your blood vessels relaxed. It also makes your blood vessels stiffer, and it makes it much harder for your kidneys to get rid of sodium. Uric acid is actually one of the labs Dr. Thomas routinely checks in his patients, especially if they have high blood pressure. And he's seen many cases where blood pressure comes right back to normal simply by cutting down on fructose and lowering uric acid. When diet alone isn't enough, we sometimes use a medication called allopurinol, which most people know for gout, but it can also help with blood pressure when uric acid is the cause. But the bigger point is this. If you cut out sugars and if you cut out processed foods, that helps both your insulin resistance and your high uric acid at the same time. It's pretty remarkable how fixing just these two things can rapidly reverse your blood pressure, even without your typical blood pressure medications. And this is the theme you'll keep noticing throughout. High blood pressure usually isn't caused by one big mistake or one single reason. More often than not, it's caused by many small physiologic stresses that add up together to create a big problem. Now, another major piece of the puzzle that constantly gets ignored is potassium. Potassium works in two main places in your body. First, in your blood vessels and your kidneys. Potassium helps your blood vessels relax, and it tells your kidneys to get rid of extra sodium through your urine. So it basically counteracts sodium retention, which lowers the pressure inside your blood vessels. And second, potassium works in your brain. When potassium levels go up, especially in the brain and the cerebral spinal fluid, it turns down your sympathetic nerve activity. That's basically your fight or flight system, the system that raises your blood pressure under stress. So by calming that signal, potassium quiets the nervous system and reduces the hormones that normally push your blood pressure higher. And the reason Dr. Thomas brings this up is because our modern diets are extremely low in potassium and very high in sodium, which is the exact opposite of what supports healthy blood pressure. This imbalance alone can push your blood pressure up even if your total sodium doesn't look that high. And then when you combine low potassium with high insulin, high uric acid, and low magnesium, that's the perfect storm. It makes your body cling to sodium and keeps your blood pressure elevated over time. So if you want to add more potassium to your routine, Dr. Thomas's personal favorites are root vegetables, things like potatoes and sweet potatoes, then vine fruits like tomatoes, cucumbers, and eggplants. Leafy greens like spinach are also high in potassium. And don't forget legumes like chickpeas, beans, and peas, which also give you a lot of good fiber. And by the way, if you're keeping track, many of these foods also help you get more magnesium, so you get a double benefit from the same plate. Now, this isn't a complete list of everything that can raise your blood pressure. What we haven't touched on is how other micronutrient and vitamin deficiencies play a role, things like vitamin D or B12. We haven't talked about homocysteine because that matters too, and neither have we covered stress, sleep, or secondary endocrine disorders like primary aldosteronism, which actually shows up in anywhere from 8 to 20% of cases of resistant high blood pressure. But Dr. Thomas is going to go deeper into all of those topics in future videos. The key takeaway here is to address these factors early, before the damage inside your blood vessels sets in. Because once that damage builds up, once your blood vessels become stiff and lose their elasticity, that's when high blood pressure becomes far more difficult to reverse. I hope this was helpful. Stay healthy, and I'll see you in the next one.